Hello everyone. Today in the series of Dr. Kale interviews, we have with us Dr. Subhash Kale, who is a consulting physician and diabetologist, now in his 54th year of practice in Pune. He started specialty diabetes clinic in 1962 at BJ Medical College and Sasson Hospital in Pune. He was honorary professor of medicine at these institutions till 1992. Thank you, Dr. Kale, for being with us.
It's a pleasure.
So you chaired a session related to newer technology in diabetes.
That's right.
Like fundus camera for retinopathy, gadgets for peripheral neuropathy and arterial disease, right? So I'd like to ask, what do you think about these advances?
You see, any advance in medical examination or clinical diagnosis is always welcome. And we are progressing very fast with digital era. Now we have got these cameras, we have got these gadgets. That's very good. We must have new things coming up. I remember when we used to examine urine in a test tube and put these drops of urine in a blue solution and boil it. So when the strips came for urine sugar examination, we thought it was a tremendous progress. But now this progress is going with leaps and bounds. But I am afraid this progress should not replace clinical examination. The doctor to patient relationship is very important. This should be a supplement for clinical examination by the patients. For example, now this fundus examination camera will take pictures. Earlier doctors were carrying a stethoscope and a box of ophthalmoscope. They were proudly carrying it and they will examine every patient's eyes.
Exactly.
Similarly, these new gadgets are examining pulse in the legs or sensations. Now doctors should not replace this by they are already examining by clinical methods like touch, then vibration with a tuning fork. We must continue to do that and supplement for better diagnosis with this technology.
Right. Okay. Thank you, Dr. Kale. But then how do you think this technology will change the relationship between doctor and patient?
Well, we should not allow it to change because what is the most important is the personal rapport that a doctor has with the patients. If you examine a patient yourself, then you spend at least half a minute, 1 minute, 2 minutes with him. During that time, you can have some dialogue with him, ask questions, ask some history, and even doctor's benign gentle touch is reassuring for the patient.
Exactly.
We should not let that go. We must have this practice to continue, but have the technology for better diagnosis, confirmation of diagnosis. So that all depends on the medical profession, whether they use the technology to replace clinical examination or supplement it.
Okay. So Dr. Kale, is this technology even being accepted by the doctors and the patients as well?
Well, the technology will be accepted. I read an American study which says that patients want newer technology to be used, but even the American patients want more and more personal relationship and personal contact. If we lose that, you see what is happening around us now. If a doctor loses a personal rapport with the patient, he loses the trust with the patient. That should not be allowed to happen. And doctors are not alone to be blamed for that, society is to be blamed. But personal rapport is most important. And it's up to us to maintain that.
That was great, Dr. Kale. So lastly, what key message would you like to share with the community?
I would like to say that let us build a trust between the medical community and the patients. Let's have dialogue with the patients. Let the doctors have time to give to the patient. Let's satisfy them by conversation. That is what is needed.
It was great talking to you, Dr. Kale. Thank you for being with us. Thank you.